Hello, welcome back to the Bunion Talk. I'm Dr. Daniel Wu in Hong Kong. I'm going to talk to you about how bunion feet can be managed more rationally. To start, it is necessary to reiterate from my last talk that the bunion is made up of normal bones being displaced due to insufficient protection from their weak ligaments. Therefore, fundamentally, bunion is a ligament issue. Since there are no ways to strengthen ligaments with medicine or therapies, so bunion is a progressive condition that can eventually become bad enough to compromise the basic walking function of the foot by making it more strenuous and less stable. So, what can the sufferers do to lessen their suffering from bunions in the meantime without surgery? Conservative management can help relieve pain, although not curing the problem, by wearing wider and softer shoes, toe separators, foot orthotics, taking anti-inflammatory painkillers, and physiotherapy. Should the bunion condition becomes unmanageable and affect one's daily activities, then only surgery can possibly correct the problem. When it comes to surgery, choosing the best one out of the dozens of different bunion surgeries available can be a difficult decision because there are just as many different opinions. Basically, bunions can be corrected by three different approaches: cut and shift bones, fusing joints, or rearrange soft tissue structures. Before deciding which surgical approach is best for your foot, it is necessary to know that the underlying cause of bunion deformity is the incompetent supporting ligament for the tilting first metatarsal bone. It is also important to be aware that the fundamental objective of all bunion surgeries is to restore the normal walking function of the foot, not just its look. Correcting the bunion deformity is actually quite simple in principle, which is to upright the tilted first metatarsal bone and then also to fix its incompetent ligament problem so as to stabilize it and prevent it from tilting again. To upright the first metatarsal, the cut and shift concept has been the most popular among surgeons, but non-bone cutting and non-fusion techniques are gaining popularity for good reasons that the Leaning Tower of Pisa has also the same problem as the first metatarsal, in that they both are normal structures and they lean only due to their inadequate external support. For the tower, it is the foundation, and for the first metatarsal, it is the ligaments. Obviously, one would not suggest that the cut and shift concept of bunion surgeries for the leaning tower to upright it. But that's what has been happening to bunion feet. By doing so, the normal first metatarsal bone will be inadvertently deformed and can compromise its mechanical function for walking. There is also the non-bone cutting technique to upright the first metatarsal by tying it to the second metatarsal. this particular non-bone cutting syndesmosis procedure would also induce a natural fibrous bridge formation to bond the first metatarsal bone to the second metatarsal bone to prevent them from separating again, which has already been shown in a 10-year prospective study. Without cutting bones, postoperative pain is less, and the patient can walk the next day, although with some activity restrictions, and require a 4-foot cast to protect the fibrous bridge formation for 3 months. Since the syndesmosis procedure does not cut up bones, its risk and the complications are low, and it has also been proven capable of restoring foot function consistently by Wang, Wu, and Leung. Severe bunion deformities can also be corrected the same way as milder ones, because the same correction principle and the procedure should be applicable to the same problem irrespective of the severity. My conclusion is that the bunion deformity can be satisfactorily corrected without breaking bones or fusing joints or having recurrences. Thank you for your interest and attention. I hope you have gained some insight into a more rational approach to the correction of the bunion problem. For more information about the syndesmosis procedure, please visit my website, www.bunioncenter.com. Thank you. Bye-bye.